Okay. So as we all know, worldwide, there's been the lockdown or restrictions imposed in all countries in order to try and curb the COVID-19 pandemic. And as we know, there have been lots of repercussions of that. For example, the closing of gyms, recreational centers, schools, and so on. So this has created in some sort of panic. What do? We are stuck at home. How do we get active, especially amongst sports people? So what we have done is, in order to help assist with this, we've developed these policy briefs. What was on the positive, governments clearly recognize, not only in South Africa, but Africa and worldwide, have recognized that the need for physical activity is important, whether it's for physical well-being as well as for mental well-being. But in saying that, there wasn't anything to help guide people or nothing that was put into place. Because as we know, human nature, I mean, especially even as coaches or teachers, we always say, give us something in writing. Let us see something. We want guidelines. Guidelines are always easier to follow and makes things a bit simpler. So in order to help with this, what we've done to provide this guidance to governments and society in order to help implement national plans, policies, and programs, there was a consortium of academics. This is about it started off with about 40 academics, and it increased over the months to probably about 50 academics and researchers from 9 African countries. So it wasn't just South Africa. This was a consortium of academics from across Africa that have developed these policies. So the initial policy, if you look on the top left of your screen, we started off, this was spearheaded by Professor Vicky Lambert from the University of Cape Town, where she initiated this brief, again, with the whole consortium of academics. And this was more for the general public. So we also have guidelines for general public activities. So this is where it started. Then from there, we moved on to where we said, now there's a gap. We dealt with the general public, we need to move to children. And as earlier Cassie mentioned as well, you need to start with what do you do at home. If school is closed, no sport is being played, you can't just go straight into sport. You need to start working with your fitness levels and so on. I mean, coaches, you'll be very aware of all of this. So the first the second policy brief, I should say, with regard to children, that also provides guidelines for activities, as we mentioned, home. It did give a bit on schools as well as the communities. Because remember, at this stage as well, our lockdown guidelines were relaxed, if you want to say. We moved from level 5 down to 4 and then quickly to 3. And these briefs came out during level 3. So there were some restrictions in place, not only in our country, but in Africa as well. Then again, we've seen a gap where it was, although we focused on children as a whole, what about children with disabilities? So we also wanted to be very inclusive there. So hence the third brief, which included now guidelines for children with disabilities. Then the talk again, as many of you mentioned, the coaches, what do we need? We need to get back. The levels are going to be reduced. We need to start sport. What do we do? What guidelines do we need? So hence, Candice, in fact, this is the one which she spearheaded, and we developed this brief. And speaking about that, we're going to go into more details on that, and I'm going to leave that to Candice.
Okay, thanks, Rowena. So this particular policy brief was really initiated because of reactions from coaches and schools, because of a lack of clarity in terms of how they could start sports participation. And the reason why we're so passionate about this is because we know that sport and physical activity has huge mental, physical, societal, social benefits for children. And that it goes far beyond just participation in soccer, rugby, cricket, netball, whatever the case may be. And that schools provide many opportunities for physical activity. And it's not only in terms of organized sport, which this policy brief is specifically looking at, but also structured and unstructured play and physical education within the formal curriculum. And also through informal sports participation as well as formal sports participation. And then looking at competition, so both intra-competition as well as inter-school competition. And our premise is that sport is an important driver of physical activity, and that we need to initiate some form of sports participation sooner rather than later, to ensure that we get the benefits associated with sports participation. So this particular policy brief focuses on organized school sports and provides guidelines on how to manage school sport during a pandemic such as what we're going through at the moment. And it's premised on the fact that it is important for mental and physical health, and is also enjoyable and a foundation for acquiring life skills and promoting social interaction. And as Rowena said, it draws on the other policy briefs. So here we can see the first figure in the policy brief is looking at lower to higher risk sports participation for team sports in particular, because that's where the risk increases. Individual sports where there's greater social distancing poses a lot lower risk than team sports where there might be closer participation between the pupils. So the lower risk is what we would focus on probably in level lockdown 5, where skill building and drills at home can still be given to children. Then it moves into team practices, where schools are working with their own pupils, and then it moves to within team competition. So you get schools competing with teams and separating their teams into different categories and competing against each other. And then we get competition with teams from within your area, and then full competition from different areas. And all of this information that we're providing has also been adapted from international data, and in particular the Center for Disease Control, which is referenced in this particular figure. So these are the ideas that we have, and there's no prescriptive recommendations. All of these recommendations have to be adapted dependent on where community levels of transmission are at that particular point in time, and also have to be seen in context of safety guidelines developed by health departments at both the national, regional, and local government level, as well as direction by the World Health Organization. And I think that's why it's a bit complex for all of us, is because we're getting directives from various sources. So I think most importantly is the community levels of COVID-19. And this is going to differ in particular areas if we're looking at South Africa in particular. And we need to look at that risk. And if that risk is high, then we need to reduce the participation in team sports in particular. Then the physical closeness of the players. If sports require contact or close proximity, and that's less than 1.5 meters between players, which makes physical distancing more difficult, obviously carries a higher risk for infection. And in particular, there's been a lot of debate about close contact sports, for example, rugby, soccer, or basketball. But play can be modified depending on the level of restriction we're in. So skill development, fitness training, even in hard lockdown levels can be prescribed by coaches. And coaches should also be encouraged to modify practices so players work on individual skills rather than group activities. Then importantly is the level of intensity of the activity. Research has shown that the higher the level of intensity of the activity, the higher the risk of transmission of COVID-19. So low intensity activities carry a lower risk. I'll go into indoor and outdoor activities just now, but also in terms of length of times that players are close to each other also increases the risk. So the longer the period of time you are in close contact with someone who might have been exposed to COVID-19, the higher the risk to other players within the particular scenario. Thanks, Rowena. And then in terms of the setting, it's important that in terms of indoor and outdoor facilities, so outdoor facilities create a lower risk than indoor facilities. And if activities have to be done indoors, then ventilation is important. I think in terms of most sports, shared equipment and gear needs to be properly sanitized. And I think most people are aware of of these common practices is not touching their own mouth, nose, or eyes, and where possible, sharing of equipment should be avoided or minimized. And if this isn't possible, then they should be disinfected between use by different people to reduce the spread of the virus. Then physical distancing while not actively engaged in play. I think this is also important because research has shown that a lot of the risk, the exposure to risk is not actually when they're playing the sport, but when they're in the change rooms or traveling between different schools or just chatting with each other on the sidelines. And that's often where adherence to mask wearing and social distancing isn't adhered to. So that's a type of educational component that needs to be brought in, as we tend to focus just on the sport itself rather than what's happening before and after the particular sport. And then the age of the player is important. I think older pupils are more likely to follow directions than younger pupils, and younger pupils might need more help from coaches and parents to monitor their children and ensure that they're following correct health and safety protocols. And then you also get high-risk individuals, so individuals with comorbidities, so people who might have obesity or have other comorbidities may be at a higher risk. And that's where we need to be careful in terms of their exposure to other children. And that needs to be monitored by the coaches, the parents, the staff at the school. And then the size of the team. So sports with many players in a team increase the risk of spread of the disease rather than if we have fewer members of the team. And also that's got to do with proximity to each other. Then we get to non-essential visitors, spectators, and volunteers. There should be limitations in place on non-essential visitors, spectators, or volunteers. And then travel outside of the community. I think, again, this depends on levels of COVID in various areas. So if we located in Makanda in the Eastern Cape and our levels of COVID are low and we want to compete against schools in East London, for example, and their levels have risen, then that's probably a high risk situation. So it must be dependent on levels of transmission at the community level. And then the behavior of the athletes off the field, which I've alluded to already, and I think this is quite important, is educating players and coaches about what happens off the field. So mask wearing, hand washing, sanitizing, all those types of health messages that are coming through quite strongly. And in dressing rooms in particular, because that's where athletes tend to let their guard down and where there's no one watching them, is to make sure that they adhere to health and safety protocols there. And then the masking abilities is where possible, sports should allow people to engage in sport with masks, but obviously there's some sports where this cannot be tolerated. So then they should be worn immediately before or after that particular sporting activity.
Okay, so I'm back in here. All right, so as part of the briefs as well, what we did is we worked on a one-pager infographic. So this was just a screenshot of the entire brief. So it's something which, you can take out of the brief, whether you want to print it out, hand it over to students or in your classrooms or on the field. It's really up to you all in change rooms and so on. So basically what we said here, it's, as you can see, it's the protection and safety measures. And the first bit we mentioned, which is in more detail in the policy brief, is the acclimatization phases. And I think this is something that is important, and it's a guideline that coaches should use. So part of what Christie says has included this, but again, we've broken it up into maybe timeframes that could be able to help coaches. So in the phase one, as mentioned as well, education. You first need to educate your athletes or the kids. We shouldn't take it for granted that, yes, we do know COVID has been around for a while, but education is still key. The children need to know do's and don'ts about it, whether it's from social distancing to wearing a mask, whether it's you reiterating, make sure you wash your hands, do not share water bottles, simple things. So it's all about educating them and constantly reminding them. Education alone is not necessary just with children, but that's also with their parents, other teachers, and so on. So everybody needs to be educated about the plan. Okay. Again, different schools may have different policies in place, or they may have certain guidelines which they want to follow. Remember, what we say in here is not prescriptive. It's just a guideline. So what may work for you may not work for another school. So you need to decide what works for you as the coach. So that's the first phase. That could take a week, a couple of days. Again, it depends how far along or how much your school has emphasized education. Now, the second part within the next 2 weeks, again, Christy did mention this as well. This is more individual team practices. So this is basically those within the school. So let those children acclimatize with playing amongst one another. So don't bring in outsiders as yet, no inter-school competitions or games or inviting other teams over. This is just amongst the kids within the school. So that should take at least those 2 weeks. So within that, again, make sure you are adhering to the COVID safety guidelines there. I know there's a lot of talk about using a mask. Do you use a mask? Don't we? Contact sports and so on. So again, it's a bit of a gray area. I mean, in sports especially, there's no mask wearing, So, but again, that can increase the transmission of COVID. And of recently, if you've all been aware of news around the world as well, in the US and even Europe, certain European countries, and even a bit in the UK, because school sports has started now, there's an increase in transmission. I think it was the US where they actually decided or in certain schools, there's a 2-week pause of sports now because it has increased. So again, also here in South Africa, we're not sure what may happen. We can get back into sport, and then before you know it, there may be an increase in the transmission, and then we may have to stop. So there's no answer which we can tell you, yes, this is what you have to do and it'll be fine. We have no idea what can go on. Moving to the phase 3, then again, you slowly progress to your competitive sports setting and so on. Again, within the competitive sports setting, these are certain guidelines which we've mentioned in the brief, but just here as an infographic, simple ones, under sanitation, the hand washing, which is always there, have stations and so on in place. Education, I mentioned. Again, as the coach, you need to also be well educated about signs and symptoms. If you see a child that may be experiencing symptoms of COVID, the flu symptoms and so on, you need to make sure you stop the activity, take them off the field. There could be also protocols in place which your school needs to have. I know not all schools do the screening, but that is something that should happen, especially when it's sport and close contact. So you need to ensure that screening protocols are in place. And again, if somebody is tested positive, or you suspect there's a positive case, you need to ensure there's a protocol where they see a doctor or physician and they need to isolate. And when they return, they should actually produce a medical clearance certificate, because you shouldn't be taking any chances. Even although they've had their 10 days of isolation, they still need to be cleared, because sometimes the 10 days is not enough. I mean, there've been cases where it can go up to 30 days where a person can test positive for this. So it's very important to ensure you have protocol and illness protocols in place. Again, social distancing, again, depending on the sport, this can become very difficult when it's contact sport. But if you have in physical activity or training, fitness drills, then maintain your social distancing. Again, ensure that they can use masks, especially if it's a non-vigorous activity. One thing I know with children, I mean, not only children, even us as adults, I mean, the high-fiving and fist pumping and so on, it's something which we do, it's part of the game, part of the sport, but that's something you also want to try and avoid with the children. So rather try or encourage them to limit contact. Maybe you'll need to try a new dance or move when they, win a point or whatever it is. So they can be a bit creative as well. All right. And again, face coverings as well. As we mentioned about the mask, you as the coach as well, you should ensure that you always are wearing your mask. Obviously, your players, they may not use it, but you should, because also you're a role model. So they need to see that you are using it as well. Non-playing players, so if they're off the field, they should be sitting with a mask on. And lastly, also importantly, ensure that the kids wash their masks. Because I mean, you know, you're using it the entire day, you're sweating, they'll get dirty and so on. So then you need to encourage that. So that's also part of the hygiene process. So again, this is just a quick infographic, just to give you some idea on what the whole brief is about. And yeah, it'll be great if you could share it even with the parents. So it's something you can just send off with your parents. Okay, next slide. Again, in the document, there are lots of little infographics and little checklists which you can use, which will help you. I'm not going to go through the details of this, but again, this is also adapted from international literature, and I'm sure most of you all are familiar with this. But again, these are simple little reminders of what to do, especially for children. So if you have it out there, whether it's little pamphlets or little flyers stuck on the wall around the school, it's just to remind them. Okay, I'm going to hand over to Candice.
Okay, so I'm not going to go into detail here. I think also part of the policy brief is to alleviate some of the fear of participation in sport. So our contention is that the benefits of participating in sport outweigh the risks if you follow adequate health and safety protocols. And also in terms of sports development globally and into the future, particularly within a South African setting. So if you follow health and safety protocols like the sanitization processes, cleaning equipment, making sure that they hand wash, that everyone has their own hydration bottles, that sanitization is available, that facilities are cleaned, all of those are ensuring that people feel a lot safer to participate in sport. So alleviating that fear that maybe parents or pupils may have. Education is a huge one. Again, this alleviates the fear, and there is a website link there that you can go to for educators and coaches, where you encourage open communication with children, because a lot of them might be getting the fear from their parents or from their grandparents. Children should not participate in sport when they're feeling sick or very fatigued, and Rowena's already spoken about that. Parents and caregivers should be encouraged to see a healthcare practitioner if they show signs of COVID. And again, so it's just being aware, and the educational side is particularly important, not only for the coaches, but for the pupils and the parents. What I want to highlight here is pre-participation protocols and illness protocol. I think a lot of schools already are doing COVID screening protocols on entry to school. So that should suffice for sports participation as well. And should they develop any symptoms, Rowena's mentioned that they should be immediately removed from the situation and be referred to a medical practitioner. But I think I want to highlight the last bullet or tick point at the end, is if a child has had COVID-19, they should get medical clearance to participate again in physical activity and the relevant sports in which they participate. And this should be kept on record by the school. I think it's just a safety procedure for the school in particular. And this is also important because of the individualized response to COVID-19 and should be considered as part of the return to play strategy at a school level. And for those of you who are not aware of what return to play is, it's just the strategy to get an athlete back to full participation in sport without restriction. So it takes away the responsibility from the school and puts the responsibility on the medical practitioner, who is the expert in the particular field. And then social distancing in all instances. So this is not only on the sports field. As I say, most of the transmission cases seem to be off the sports field. So parents particularly may be watching on the sideline, not adhering to safety protocols, and then also pupils not adhering to safety protocols in the changing rooms and in areas surrounding the sports field. So again, it comes down to education and the protocols that the particular schools put in place. And then face coverings, again, we've mentioned this, is face coverings when not participating in sport. It's particularly difficult to wear face coverings in certain sports, but when you're off the field, or if it's a choking hazard, particularly in sports like gymnastics and cricket, it's really not safe to wear a mask. So in those instances, they shouldn't be worn. And again, Rowena mentioned the cleaning of the masks is important, particularly with sweating profusely in vigorous sports. And then here's also a checklist that's available in the policy brief for coaches that will be available for you, that Sean will send out. So this is just about being a role model, education, how to prepare the facilities, how to ensure social distancing where appropriate, and cleaning and disinfectant, and looking at lower to higher risk situations. And then just to end off, this has just obviously been a brief overview of the policy brief, is there are particular people that are listed there who have made a huge input to this particular document. The whole policy series has been led by Professor Vicky Lambert from the University of Cape Town. And we've had technical support from all of those academic consortiums that you can see there. And we'd just like to acknowledge them and their contribution to this particular policy brief, and for the support that people have given us. Thank you.